just, I guess, to summarize so I understand it too. So you mentioned, it's almost like everyone says, you have thyroid problems. Let's look at the thyroid. So you're really saying that high cholesterol is a huge indicator of low thyroid, and that we can actually look at the contraction or the lack of thereof, relaxation of the calf muscle as another indicator of, we could say, I don't want to say thyroid problem, but maybe slower metabolism or maybe a thyroid issue in a sense. Is there any other things you recommend? I know you talk a lot about pulse and temperature and things like that, and I'm sure that's a huge topic, but maybe we can chat a little bit about, why you look at body temperature and why you look at pulse. And, everyone else is focusing on TSH and free T4 and free T3 and TPO and all this stuff, and I don't know if you do or don't, but maybe you want to touch on maybe if you don't and why.
Okay. Well, the idea of free and bound hormones, it's purely a laboratory construction. And in the case of thyroid, it usually has some relation to symptoms, but it's a little bit analogous to reading tea leaves, because actually when thyroid hormone is stuck to the albumin protein, which is the main protein in the blood, it has no trouble at all getting into cells, taking the thyroid into the mitochondria and nucleus and so on. So the free thyroid test does correspond for a variety of indirect reasons to the real available activity of the thyroid, but it's really just a laboratory construction that should be minimized.
So even touching upon TSH, what are your thoughts on TSH, even in regards, because I know a lot of the different values out there are very different, and they're always changing a little. If you could touch upon, if you even would recommend focusing on TSH that much, and if you do, what would you say some of the values should be?
I don't recommend it as a way to diagnose hypothyroidism, but I do recommend if you're looking at a blood test, I would recommend having as close to zero TSH as you can get, because all of the known effects of TSH are really harmful in some way. The main reason doctors are giving currently for not wanting to suppress TSH is they think because TSH reduces the turnover indicators of bone, that this idea developed as a way to sell estrogen. Estrogen was never shown to increase bone growth in humans, but it did stop the osteoclast function, so it reduced bone turnover. And so they said this is evidence that estrogen is preventing osteoporosis because it stops the breakdown of bone. And since TSH also stops the osteoclast and the turnover of bone, doctors said if we suppress it, that'll cause osteoporosis. But in fact, it's the indicators that were used to argue that estrogen was protecting the bones, they named a protein osteoprotegerin, meaning bone-protecting protein. And for several years, they were using that as a way to sell estrogen and other drugs that would increase it. But pretty soon it turned out that osteoprotegerin is closely associated with bone loss, osteoporosis, osteopenia, and calcification of the soft tissues. And it turns out that thyrotropin, TSH, like estrogen, increases osteoprotegerin, increases the movement of calcium into your arteries and heart and out of the bones. So the main argument doctors have for keeping your TSH up to not below 1 is often what they say, but their very evidence is the opposite of what they think it is.